TBRI.
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 TOVD.
TBRI.
TBRI, Trust-Based Relational Intervention.
TBRI is an attachment-based,
Trauma-informed intervention
that is designed to meet the complex needs
of vulnerable children.
TBRI uses empowering principles
to address physical needs,
connecting principles for attachment needs,
and correcting principles to disarm fear-based behaviors.
While TBRI is based on years of attachment, sensory processing, and neuroscience research,
the heartbeat of TBRI is connection.
Hey guys, welcome back to the podcast. Thanks for being here.
Yeah, thanks for having us.
Yeah, it's a pleasure.
Would you each introduce yourselves as far as your role within the organization and kind of how that plays out? Leah, will you go first for us?
Yeah, absolutely. So my title is the Senior Director of Trauma-Wise Practices. I am a licensed clinical social worker, and my main role within the organization is to oversee the implementation in every single thing that we do with the 3 pillars of trauma-wise care, with TBRI being the way that we're going to do that.
That's it?
That's it.
Feels like a monumental job. Scott, how about you?
I am the trauma-wise consultant.
Okay.
I'm also a licensed professional counselor, and my role in the organization is basically boots in the ground, trying to make sure and support, scaffold, mentor, coach teams in implementing trauma-wise practices, and TBRI being the way that we do that. Okay.
So I'm going to say, to me, Leah's job sounds like more meetings, and Scott's job sounds like more fun. Just saying.
Yeah.
Exactly.
Yeah. True words never spoken.
Yeah.
But there's
no takebacks on that.
He's staying put.
That's fair.
Oh, but there's something you didn't say. Both of you this semester are serving as adjunct professors for us at TCU in the Institute of Child Development, Department of Psychology. How's that going?
So fun.
Yeah.
So absolutely. Yeah. The students are amazing. It's been a joy to get to serve in that capacity. Yeah.
Yeah. It's been really fun to kind of watch what's coming up, right? Because, Scott and I, this is not just for our own experience. It's like, how can we get these students to come work at MHMR when they're done, right?
Right.
They are so smart, and I've learned so much from them. It's just been a really fun experience that I hope to do again in the future.
Yeah.
Mm-hmm.
Oh, that's so cool. I know when Casey told me, she was like, "You're not going to believe who I got." And I was like, "I already know." So, yeah, I think that it's really extraordinary at the Institute when we can have people in the community serve and meet the needs of our students and expose them to different things. And I just can't imagine the impact you two are having. So thanks for doing that. It's super fun for me because you're 2 of my favorite people. So to get to have you both on the screen is just a real treat. We are going to chat today about the idea of TBRIing our team and the people that we work alongside, the people that work above us in the org chart and below us and laterally, the whole thing. And I know you guys are deep in the waters with that. Leah, I think we touched base on this on your previous episode, so people could go back and listen. But if I remember correctly, on that very day that we recorded, you guys had a massive overhaul and kind of changed directions. And so let's dig in. Leah, can you just tell us a little bit about your organization and your mission?
Yeah, sure. So My Health, My Resources of Tarrant County, we're the licensed mental health authority for Tarrant County and surrounding counties, and we provide community behavioral health, right? So we serve youth and adults around the field of mental health, behavioral health, substance use disorder. We really serve through the lifespan. So we even have prenatal programs that work with women who are pregnant and just needing a little bit more support. We also work with children with developmental delays, intellectual delays. So really, we touch the lives of almost everyone in Tarrant County, it feels like.
Wow. So it's kind of the womb to tomb thing, right? Like
womb to tomb. We didn't want to put that as our mission, though. Womb to tomb.
That's not your hashtag.
No.
No, I wouldn't think so. So literally, you guys are across the gamut. Somebody needs help. In many ways, you guys can offer that support or even lead them to where they need to be. So I remember when you first were applying for your position, Leah, years ago, and I know your position has changed since then. But what inspired MHMR back in the days to make this transition to move to a trauma-wise practice into the world of TBRI, the three pillars, all of that? What kind of instigated that change?
Yeah, it certainly evolved over time. When I first came on board, and I'll kind of tell you through the lens of my experience what it's looked like. But when I came on, the focus primarily at that point was implementing TBRI into an early child home visiting program so that staff would have a tool in their toolkit to serve these families. And it soon became known just through practice and learning from decisions that you'd made in the past that maybe didn't pan out with trying to implement TBRI, into how we're just going to do relationships at MHMR. And, the thought behind this, right, and we all know this, it's one of Dr. Purvis's best quotes was that, you can't lead a child on a journey of healing if you don't know the way yourself. And if you take that and you apply it to the context of an organization, right, if we're not living out the three pillars of connection, felt safety, and regulation in everything that we do, then how are our staff able to go deliver this to the community? They have to feel it within their bodies, right, in order to go deliver this service. And so now it really is about how do we transform this entire organization to be trauma-wise in everything that we do, decision making, yes, within programs, of course, but how we work as an executive leadership team as well. It is everywhere.
Wow, I really love that. So I think when I think about my journey into trying to transform an organization before I joined the Institute, one of the biggest trickies was to shift the mindset of the people within the org to see others' needs, whether they're my coworkers' needs or the people we're serving's needs, to shift the mindset from that willful lens, which is like they just don't want to show up for work, or they just are this, that, or the other, or that kid just doesn't like whatever, into the survival, meaning like this behavior has some meat behind it that's probably rooted in some trauma. So Scott, as you guys have begun your journey, and we'll talk a little bit about your kind of what that journey has looked like in just a second, but how did y'all start with that process of um, trying to shift that lens with your teams and your coworkers? And I know you guys are in even different levels of leadership. What does that look like?
Well, really, what we had to do is shift our mindset on our staff and who we were working alongside. Working in the helping industry, we're going to be more susceptible to having folks who work with us and work alongside of us who have experienced harm and experienced trauma. And so when we recognize that, we can really take our leaders and help walk them through what sort of harm our staff could have gone through. But we also know that TBRI is for everybody. It's the language of relationships. And so when we really took a shifted our look for how we looked at our staff, it changed everything. And so when our leaders started treating our staff with respect and through that survival mindset, and instead of that willful disobedience, we started recognizing there's needs behind their behaviors. And when the staff started feeling that, they were able to take that to the folks that we serve.
Do you think there's a point when the staff see the same thing for the leaders, where that becomes a reciprocal thing?
Yeah, it's really interesting. But one of the ways that we've been able to implement trauma-wise practices is through leadership training. And so with our leadership training, we've separated our leadership. We've got probably close to 300 leaders in our organization, serving over 2,000 employees. And when we do that, we separated them into cohorts. And one of our first questions that we ask every time we set aside a cohort is anybody else's boss in this same room? Because we want to develop that level of felt safety. Okay. And so we set aside that time for those leaders to really focus on leadership and serving their staff. And what's interesting about it is when we're working with the leaders, they go, oh, how does this apply to my boss? Because everybody's got a boss, and they start really focusing on how they can start looking at their boss's behavior as there's probably a why behind that behavior as well.
Turns out. And like, I think one of the complexities from staff to supervisor is that staff don't need to know all the information the supervisors know, but sometimes that information drives a decision that impacts the staff. And so there can be so much complexity in that. And I think as a supervisor, it's really important to be aware of that because you still have to, you may not be able to share the why behind a decision, but you still have to create felt safety around that decision. And that is tricky. Okay. So you guys know that at the Institute, the implementation model that we have chosen to use to help organizations implement TBRI is historical activity theory, or as we call it, CHAT. Um, and so we're going to talk through a little bit about the process of your implementation. You just said 300 leaders, over 2,000 employees. I would argue that many, many, many of our organizations don't even have 300 employees. I mean, the foster care organization that I worked to, I think there were like 80 of us total. So then we're coming down to like a 6-person leadership team, which, so we understand there's some big complexities and I would venture to guess that you're not you're looking at smaller kind of micro doses of what that looks like. So, Leah, what has the process been like for implementing TBRI and in the way you're doing it? And I know you're looking through the 3 pillars. I know you're using other tools and such. So, feel free. I think our listeners are familiar with most of the tools you're going to talk about.
Right. One of the things that Scott and I know from years of, again, making mistakes and trying to recover is that there is no one clear path for implementation of an organization this size because we move at warp speed, mostly because we have to. The need keeps changing. The object keeps moving. And so when Scott and I sit down to talk about kind of the vision casting and where we're going, we really look about sometimes just 3 to 6 months out and plan around that because we know in 3 to 6 months something's going to happen and something's going to change and we're going to have to evolve and be flexible in how we're responding to respond a little bit differently and see how we're going to meet that need. And so one of the first things that we did going through this transformation that we are still in the midst of is TBRI is no longer just for those that are child serving, right? It is for the entire organization. So anybody that works at MHMR now is going to go through TBRI training. And that's not just training. There's going to be coaching and scaffolding. And I'll tell you right now, we just had a meeting about this yesterday, that the need is greater than what we can meet right now. So we're really having to pull on our practitioners to step into the space of training and coaching and scaffolding. Because people are reaching out and saying, you've given us some and we want more, and which is great. That's exactly what we want, right? But it kind of goes to one of the contradictions when we think about chat, is how are we going to meet that need? Because it's a big one. We also have a steering committee that is helping guide this process through the transformation, where the 3 pillars are essential to everything that we're doing in that steering committee. So for example, it's broken up into all these components where my role in it is the 3 pillars into all of those components. So it's not like I have one piece of the steering committee. I really have the whole thing because we're talking about continuous improvement in every single thing that we do. We also have a team that's dedicated to meeting pretty regularly about our environment. So meaning our adult centers, youth centers, all of our locations where we serve, and making sure that we're looking through the lens of how our patients might feel when they come in the door. How are we disarming fear? Coming from, again, a more industrialized model of doing things, you want staff as well as patients to come in and feel welcome and warm and that their needs are going to be met while they're there. And so we're committed to continuing that process of how can we improve this, especially on a shoestring budget, right? We are always applying for new ways to fund how we're going to make these changes to really impact our community. So we have a whole new perspective on creating elements of felt safety, connection, and regulation in all of our areas, not just in training.
So it's interesting because I had the opportunity to visit, and I apologize, I don't remember which one of the clinics it was, but it was a newer one. And it was just stunning. It was so beautiful. And 2 things I noticed right off the bat. One was that the furniture in the waiting room was like furniture that might be in somebody's living room instead of the really industrial, plasticky, you know, it's going to get messed up kind of thing. And I remember asking you about that, and you just said, like point blank, you just said, yeah, we're going to have to replace it. But our people deserve to walk into an environment that feels like we care about them and like we're more worried about their experience than the sofa. And then two, when we got back into the clinic setting again, it was so lovely. It was like it smelled good. There was music kind of in the background. It was clean and organized. Just a really beautiful space. And some of the team came out and they were like, "Can you believe we get to walk in here every day?" And so thinking about like our the empowering strategies, like you've actually created a space where people who do some of the very hardest work want to be. And it's like when we talk about, and we're going to get into some of our tools and that kind of stuff, but that in and of itself is a tool. And and yes, you had to invest in that, but there are some things you can do in, an older clinic that you don't get to put up the frosted glass and that kind of stuff. Is low, budget impact and high personnel impact. So yeah, that was really, really fun to think about. Can you really quickly, Leah, talk a little bit about what you mean by object?
So our object, right? So that is what we're trying to achieve. And of course, you've heard me say this a million times, Sarah, but we really adopted the phrase that we chase needs and not outcomes. And so our object is what we're working towards. But when you talk about an organization, Scott mentioned earlier about 2,000 employees, and I don't even know how many different programs and grant funded programs we're running throughout that all of them are going to have a little bit different of an object, but how does that still serve the ultimate object that comes from our executive leadership team? So is that to make us a trauma-wise organization? Is that to recruit and retain talented staff? The object moves from time to time. And we could also be talking about some programs where maybe felt safety is the biggest need in their program because of changes and transformations that they've gone through. Maybe it's regulation. And a part of these cohorts that Scott has talked about, these trauma-wise cohorts with these leaders, is they're also telling us what their greatest need is. So we have a survey at the end of each time kind of saying, we've introduced these concepts. What is it that you want next? And felt safety just edged out regulation by a hair, by a small hair. They said, let's go to felt safety. Which has been really cool to kind of dig into that. And then next, we're going to move into regulation because that was what was next. And these are relatively new terms for folks. And so we may have one team, like I said, where the object for them is going to be, how do I create an environment where my staff and our patients feel safe versus some who are going, we have patients that are coming in who are always upregulated, and we don't know that we have what we need in our environment to meet their needs. So what can we do in our environment to meet the need for regulation? So that's what I mean when the object changes. It really depends on who we're talking about.
Well, and I think that's a really important thing for leaders to hear. And that, in my mind, that means whether you're on the executive leadership team at a huge organization with thousands of employees, or whether you're leading a family, like, and you're a parent, right? Like the object shifting is an okay thing. That just means we're identifying a new need, right? Like that's a need that we're gonna go after. So don't be afraid of that happening. So one of the things that we talk often about is what are the roles within an organization? Scott, can you share a little bit of how the roles have changed through y'all's implementation journey? Because I know I want to be clear, like you guys have been at this seriously since your reorg for a few months now.
A few months, yeah.
And you're seeing some pretty
Yeah. Yeah. Since late 24, yeah, we've been doing this. And so number one, our roles have changed. Our focus has shifted from child and family services to the entire organization. And so I am the trauma-wise consultant for the entire agency. But
Ooh.
with that, we ended up inheriting a team or gaining a team. And there are a lot of really extremely talented people that work at MHMR, but it feels like we got the dream team on our team because we have folks working in perinatal. We have folks that are working as nurses, occupational therapists, clinicians, mental health first aid. I mean, it's like we have a team that is solid and is built, and our focus is trauma-wise practices across the agency in those different realms, in those different areas. But this is a continuation process. Very recently, our executive leadership team has started a rebranding process, and they have taken on, they still like the letters ELT, so they have renamed themselves the Empowering Leadership Team instead of the Executive Leadership Team.
Okay.
We're all for it.
Yeah, I love that. I thought you meant rebranding of the organization, and I was like, oh, that is such a nightmare. So, no, I love that. They're rebranding themselves.
Absolutely.
Oh, come on. I love that so much.
Yeah.
Have there been other examples of how roles have needed to change in light of this new implementation practice and model that you're doing?
Yeah. As far as like the way that we do intakes has changed, and so we're adding in people to be able to support families throughout that process. So we have some fabulous folks who help the families navigate through the process, and they've primarily been navigating over the phone, but they're starting to realize when those families show up, they need a face with the person that they've actually been talking to over the phone. So those folks have been meeting the families at the door and walking them through the early stages of the process until we can do what's called a warm handoff. We hand them off and make sure that they're settled and make sure that they feel safe with the person that they're going to next to make sure that their needs are being met. And we're doing this for not only families, but we're also doing this for adults as well.
Wow. I just get goosebumps every time I hear about y'all's work. Leah, can we talk about rules? So one of the trickies about rules is that sometimes we change the rules because of a myriad of reasons, right? It could simply be like, well, we used to lock up the snacks and now we want to have snacks out and available. Or it could be a kid got hurt and we have a knee-jerk response because we're afraid for safety and we create a whole new rule. So when we think about rules, I think it's important to recognize that there are like explicit rules. They're in the policy and procedure manual. Everybody knows what they are. Your time card must be done by this time if you want to get paid, or, these are our work hours, whatever. But then there's actually some implied rules or implicit rules that people just understand, kind of go with the job. So can you talk a little bit about what rules have y'all needed to change, or how have the rules applied to this evolving practice that y'all are creating?
Right. Sometimes we know that these rules can also lead to contradictions for the object that we're trying to achieve. And, some of the simplest ones, the explicit, or what we'll actually call kind of the spoken rules versus the unspoken, are the ones where we, again, wrote the 3 pillars into the strategic plan. So if you look at page 1 of the strategic plan, it has our core principles and our guiding principles. And our guiding principles are connection, felt safety, and regulation. So it touches every single thing that we do. And of course, our OPs, or operating procedures, job descriptions. So some of the real tangible things. And the creation of tools, which Scott will talk about in a little bit, some of the tools that have been created to help support the roles. Interestingly enough, we just met with our executive leadership team, or as they've been rebranded, the Empowering Leadership Team, to talk about chat, to talk about cultural historical activity theory, to see what are their roles and what are their rules and what are some of the spoken and unspoken, because we know when we talk about executive leadership that it's a waterfall effect. Right. And so it's always going to trickle down. And so what are some of the spoken and unspoken rules, and how do we get on the same page with that? Because I might perceive it one way and you perceive it a little bit differently. And it was really exciting to give some language around this and get people on the same page. I know one of the other rules that we've put into place, and I think I mentioned this earlier, but historically TBRI was only being implemented or trained on those that were child serving or in our youth services. And now it's for everyone. And it's really fun to have people from the HR team or people from our, financial team reaching out. I mean, we literally had the deputy chief over like operations attend TBRI last week. And just because she wanted to, right? That's where we're at and that's what I said earlier when we have the need is greater than our capacity. So we're having to, instead of offering TBRI once a month, we're having to look at our next fiscal year and say every other week. That's where we're at right now.
Well, I can tell you, we understand that on the Institute side. The demand is greater than we can meet. It's a hard place to be, but I think it's also exciting, right? I mean, when you think about just where you guys were a few months ago, that now you've got, people in the financial office and HR and kind of clamoring to get it. How big, really quickly, how big are the cohorts? You're doing cohorts. What is that? Yeah.
Right. There's, I think Scott mentioned, I think about 300 people in leadership positions. And I think we've broken that down into about 12 or 13 cohorts where there's about 30, give or take, in each cohort. And that includes our program administrators, that level of leadership, our senior directors level of leadership, and of course the executive leadership as well. So it's inclusive of every level of management and supervision across the organization, regardless of where you serve.
Yeah, and if I can go ahead.
Yeah. Go ahead.
No, I was just going to add to that is, Leah said 12 or 13 because we created 12. Actually, we started with 11, and then we realized the people that are leading but aren't necessarily aren't in a supervisory role, such as clinical supervisors and coaches and mentors and development team members who are in staff development, are added into their own cohort. And then the surprising thing is our HR department stepped up and said, we want this too. So we created a whole separate cohort just for our HR department because they affect every staff on the agency. So we actually have 13 cohorts.
Ooh. Okay. So are these cohorts all happening simultaneously?
Yeah, we do it in about a 2-week period. It's a long 2 weeks where we meet with a cohort in the morning and the cohort in the afternoon, and we're doing that 13 times.
Wow. So I think here's the thing. Like, if you're in an organization that wants to change, you have to invest in it. Because like you said in the beginning, Scott, like y'all's roles changed immediately right off the bat. And you're continuing to get more and more. I'm sure you're completely overwhelmed with the volume of work that you have to do. I just can't imagine what your inboxes look like. But as the organization, they have to make a commitment to do this, which means not only do your roles change for you two, but also it means that the people in all of these cohorts are now having to spend time in the cohort, which means we've shifted their work hours for this period of time, right? And that just tumbles, right? Because I imagine the outcome of the cohorts is that changes are going to take place, and that takes more time because you can't just change a rule without if you understand it, you can't change a rule without considering how that's going to impact somebody's role, or do we have the tools to meet the need of that rule, or you know what I mean? And so like it's a massive, massive investment. And I think so often, especially in our culture, we want things to happen really quickly. I want things to happen really quickly. And to know like the outcome of this could be months, even years in the making in an organization your size, because you're literally talking about changing people's minds and then changing rules, roles, tools, the whole gamut. So man, what a huge investment. Scott, can you talk about the tools that have either been changed, added? When we talk about tools, what are we talking about?
Well, I'll give a physical tool that's changed is the way we view coffee. In our adult centers, we have coffee always in the staff break room and things like that. And what we've decided to do is move the coffee pot more front and center. so that we make sure that the patients are passing by the coffee pot when they're meeting with either their case manager or their therapist. So it's no
Mm-hmm.
longer a meeting where it's focused on their mental health and things like that. It's more focused on relationship and having a cup of coffee with somebody. So that's a physical tool that we've seen change. A more conceptual tool that's changed is the way we do leadership. I'm going to give a shout out to our friend Bill Hill, who became a practitioner in
Hey, Bill.
Denver. Yeah, and Bill is a Clifton Strengths guru, and so we subscribe to Boston Coach and Gallup Strengths. He came out of practitioner training and immediately said TBRI is for leadership. TBRI is
Mm-hmm.
the way that leaders need to treat staff. And so we've created these cohorts based off of TBRI, but also implementing these skills that they've learned through Gallup Strengths and applying those strengths to make a strengths-based approach the way that we operate with staff, because those implement and work together. It just makes sense that we're using the tools that we already have, but putting that trauma-wise lens on them and making them great.
Yeah. I think it's so brilliant because I think often we throw tools like the Strengths Finder and that kind of stuff at our teams as almost a fun get to know yourself activity, and then nothing happens with it. So I do think it's brilliant to keep that language moving and going as part of your implementation, because people don't, you know what, people don't want you to waste their time. Like they're
Yeah,
they're already completely overwhelmed.
that's
Um,
right.
I would like to add that I think connecting through coffee is one of the most brilliant things you could ever do. There's nothing I enjoy more than coffee with my friends. It's true.
Yeah.
Um, Leah, I don't
Sarah.
remember where we were. Sorry. You distracted me with coffee. It takes nothing.
I knew that would happen.
Yeah, you probably did. Um, so I've heard you say contradictions a couple of times, and we haven't really talked about those. So I want to talk about the solutions to contradictions, but first, can you explain what you mean by a contradiction, and then let's talk about kind of moving through the solution process.
Sure. I think an example of a contradiction is you create a rule to help support the work, but then you can't actually go implement the rule because the contradiction exists. So,
Mm-hmm.
just what we were talking about earlier about the demand for TBRI within our organization is really, really high right now, which is everything that we want. We
Mm-hmm.
want people craving this, but Scott and I and this other team of practitioners who are trying to meet this need, there's not enough of us.
Mm-hmm.
That's a contradiction, but that tells us what the need is, right? So, how do we actually build the capacity of our existing practitioners to pull them into the fold more? And I think we've had about 2 meetings about that already of going, how do we build capacity around training, around coaching and scaffolding? So that's just one example of a
Mm-hmm.
contradiction. But when you think of an organization of our size and the regulatory pieces that we have with the state and the federal government, right, there's plenty of opportunities to get some contradictions.
Yeah. I feel like I can wake up in the morning and there's the first contradiction of my day. I want to
Yes.
be asleep and I'm required to be awake.
Yeah.
So then we talked through Wendell Berry's Solving for Pattern, and we can put that essay, I believe, in the show notes if people want to read it. It's actually about farming, but don't get distracted by that because the whole idea is really, really cool. And one of the things that we talk about is, the contradiction spits out the need. One of the things I hear you actually say a lot, Leah, is that we shouldn't be afraid of contradictions. We've heard Darren talk about that, that contradiction is actually an opportunity for growth, not something to be afraid of. And I think historically, and this is a very general statement, but we've been afraid of that, of when something comes in and maybe we take it personally that as a leader we missed something and blah blah blah. But like really, like if you have a contradiction, you just have an opportunity. So and we can improve the situation or we can make it worse. So we talk about good solutions and bad solutions. And a bad solution would create more problems, basically. I'm using very simplified language for what Wendell Berry would say. But can you give an example of a good solution, which means talk about the contradiction and what's the good solution?
Sure. I came to MHMR in July of 2020, so in the height of the pandemic. So everything I did was in a virtual world. So I've been here, almost 5 years now, and I'm just now, probably in the past year, meeting a lot of people that I've worked with that entire time. And when I think about these trauma-wise cohorts that we're doing, is that it's giving us a solution, right, for the three pillars. And we are building capacity around the three pillars, and that's going really well. And again, as I said earlier, 3 to 6 months out, we're trying to be adaptable and change as the need changes. But what's been really cool to see beyond building the capacity around the three pillars of trauma-wise care is also bringing together these managers and leaders and supervisors who otherwise may have never met each other. And we are forming really deep, meaningful relationships in this time together. Previously, or before this transformation, we were heavily siloed. It was like youth services is going to do their thing, adult services is doing theirs, disability services is over here, and early childhood and ECI, they're doing their thing. And those days are gone. Now we are all one big team who are trying to meet the needs of our community to change lives. And these cohorts are so much fun. They even, every cohort has come up with their own name. Like we mentioned earlier, executive leadership is now the empowering leadership team, right? And it's really fun to hear the names that they come up with. In our last cohort, we focused on felt safety, like I mentioned, but particularly the balance of nurture and structure in leadership and supervision. And we had one team, I just love this because it was so clever, but they created a team mascot for their cohort, and it's an alligator. And they actually drew it. And if you look at the alligator, they wanted it to emphasize balancing nurture and structure. So the alligator has teeth that are sharp at the front of the mouth, and the back of the mouth is like dull, flat teeth. I mean, just so creative, right? The balance of nurture and structure. So these cohorts have been meaningful in a lot of ways beyond what they were originally intended for. So much so that now they're becoming a place for us to bring in other elements to make sure that we're meeting needs of like just normal communication that needs to happen. We're going to include a survey in our next one, trying to understand what is the greatest need that supervisors have in order to get the most out of their supervision with their teams. So we're just going to continue to adapt and see where it takes us in the future. And maybe we change it, maybe we don't. But right now, this is a solution that's paid out in dividends.
Okay. Are you guys okay with talking about a solution that was bad?
Yeah, we don't, because we've had plenty of those. Yeah.
Because it turns out this happens.
It does. Yeah. Yeah. And we actually, I mean, we don't, obviously nobody likes it to have bad solutions, but it also points out needs. And so that's been eye-opening for us. Really, we've been doing TBRI training for so long, but what we realized is we're capturing folks with our TBRI training about 3 months into their journey as a MHMR staff member. So they kind of been out in the field, they understand their job a little bit more, but now we wanted to give them this tool, and we were noticing that there wasn't anything that was really happening after that. So it was almost like the information was dying on the vine because they're like, oh, okay, this is another training. Yeah, this sounds great. And then, okay, back to regular work. Yeah. Yeah. And so it turns out, yes. So what we realized is we're missing the connection piece. We needed the relationship piece in there, and we needed to focus more on coaching and mentoring versus training. Okay. Training can be a vital part of a coaching and mentoring plan, but it doesn't need to be the entire coaching and mentoring plan. Coaching and mentoring requires relationship. It can be painful at times, but it can also be extremely rewarding because it actually meets the needs instead of just shoving a training down their throat. Because we've got plenty of trainings to go through here at MHMR because we're regulated by all sorts of folks. TBRI doesn't need to be another regulating factor.
Oh, that's so good. Oh, and it's so hard because again, that takes more time, like to go above and beyond. And I think it's important, like I think we've all experienced some sort of leadership coming up with some new rule to solve a problem. And our first comments are like, but did you think about how that's going to impact this, and this, right? Like, did you think about how, like you've just created more and more problems for me to solve by saying this one thing. And I think that's a good step when we're starting to solve a problem, when we're starting to address a contradiction, again, no matter where we are in doing this, is to truly think through, if I make this step, will it create further solutions, or will it create further problems? Because sometimes we don't stop to just think about that. We just have this kind of really quick response because we're afraid, or because something's happened, or because we're sick of this, or whatever. And to just take that one step and say, like, is this solution going to create positive outcomes and more solutions, or is it going to create more problems for me to solve?
Yeah.
Okay. Scott, do you have a specific story or an example that you could share that might demonstrate the impact of what you guys have done so far? Because it hasn't been very long.
No,
6 months in,
I'll
7 months in.
yeah, yeah. We've
Well,
had,
let me back up. Can I just say
okay.
really quickly? I know you guys have been doing this much longer. I know since
Hmm.
the transformation, you've had your team set for several months. So I do know there's been some foundation before that, but so I don't want to negate that time that you guys spent working really hard.
Yeah, no, we've had a lot of positive experiences.
Hmm.
One in a specific team, they really wanted to kind of grasp the idea of nurture groups, and so we went in there and started coaching individual folks. But we realized everybody needed it, so what we decided to do is reshape their team meeting into a nurture group. So they start off with the rules, they have the check-in question, we actually bust out the band-aids, all the things.
Oh,
And it worked. And they said, "Oh, can we keep doing this week after week in our weekly team meeting?" And we said, "Absolutely, we can," which is really cool because that kind of caught hold of the other teams in that area. Now every team is starting to pull in different aspects of these nurture group principles, such as the
mm,
check-in question, making
hmm
sure that there are empowering principles there, such as
hmm
snacks and fidgets and water there for the team, those types of things. So it's just a good idea and a good solution creates so many more opportunities out there. It's been
Yeah.
really, really fun to watch.
Yeah, I love that. And I think the idea of like everything you just said is highly relational, but it also costs money, right? If you're
Yeah.
going to do fidgets and snacks and water and band-aids, like there's a little bit of an investment there if every team is doing it. And so I think like you guys didn't shy away from that. You figured it out.
Yeah, we leaned into
Very
it.
good.
Yeah,
Yeah.
and realized that we do need to make an investment in our staff
Hmm.
and the way they interact with each other. And we realized also some of these team meetings, these folks don't work alongside of each other because we're working a lot with field staff. And these field
Hmm.
staff, this is a touch point for them. And so
Hmm.
we've noticed that people want to work and come to team
Hmm.
meetings. They want to show
Hmm.
up. They want to be engaged. And so we're really
Hmm.
looking at it as a retention effort.
Mm, so good. Leah, can you talk a little bit about, you know, you've talked about the idea of their three pillars and them choosing even like, do we want to do self-regulation or felt safety first or connection? I mean, you're obviously doing connection just by the idea of the cohort, but um, how has that transformed things?
Well, I first want to just piggyback off what Scott was just talking about with the fidgets and the supplies, and to your point, Sarah, about that cost money. But I think what's been really cool about the impact of doing this work with everyone at the organization is that even our grants team is going, now we understand the value. And not that they didn't before, right? But having to write those things into a grant might be kind of miscellaneous sometimes. And now it's like, oh no, this is a priority because we know that this is going to immediately speak to the empowering principle that we're going to disarm fear this way. It's just had ripple effects. And thinking about starting with felt safety, one of the coolest things that happened recently, but almost makes me emotional to talk about, but one of the members of our executive leadership team who handles all the finances, right? So a very
Hmm.
daunting, scary job to be in the first place. But we're talking about data analysis finance people that reached out and said, hey, we were talking about felt safety with our team, which first
Oh,
of all,
come on.
yeah, let's just start there,
Jeez.
right? We were talking about felt safety and we think we might need some support around that. How do we create an environment where people feel safe, especially when we have these jobs that are about keeping the doors open of this organization. And so Scott and I got to meet with them, and we're going to have some follow up to that, but they're talking about that. One of the things that we got to do recently is go to the jail. Actually, Scott got to. I got hung up at an airport with you, Sarah. So Scott got to go. I hope to go. I'm going to jail in the next couple of weeks, which is going to be really exciting. I know that's an ironic sentence to say out loud. Because the staff is sitting through the cohorts going, this is wonderful, but for our staff, but how in the world do we create an environment where the folks at the jail feel safe, right? How do we do this, especially with all the contradictions that exist in an environment like that? And how exciting is that we've got staff now going, you've got some tools, we want them, can you make them adaptable for what we're actually doing in the day-to-day? And Scott got to go out there and just start talking about the attachment cycle and meeting needs. It's just really cool to see the response now that we have embedded this language, which this won't be surprising to you, but we know now that they know what felt safety is and what it isn't, what it looks like, what it doesn't look like, is now we have an increase in staff saying, I don't know that I feel safe. But they're doing so because they know that their voice matters now. They know that they actually can bring that forward because it's going to be received in a way where we can actually repair maybe a rupture that occurred. So felt safety regulation, people are asking for it. They are reaching out and asking for it in different ways, not just in their team, but also in how they're serving, which is ultimately that's the end goal, right? Is how do we get this to the people?
Gosh, that's so good. It's just so good. And I think a few minutes ago, I literally just said this is a really long process, dig deep. It's going to take a long time, but some of those outcomes already are happening really quickly. And so I just can't, I can't imagine how that feels to be y'all and sit back and watch it. Cause I know the task is daunting to you, but also well done. Well done. Okay, Scott, if you'll go first, and then Leah, if you'll finish us up. If you guys could sum up TBRI's influence on your organization in one sentence, what would it be?
TBRI has become, and is becoming the lens of everything that we do. It's how we do business.
No pressure, Leah.
I believe that we are now an organization that is truly and authentically working towards chasing needs and not outcomes.
Ooh, mic drop twice. You guys, thanks so much for being here. You're absolutely a dream. We really appreciate you.
Thanks for having us.
Yeah,
we appreciate you guys, and thanks for y'all's support.
Absolutely.
The TBRI podcast is produced by the Care and Purpose Institute of Child Development at TCU. To learn more about TBRI and the resources mentioned in this episode, please visit child.tcu.edu/podcast.